Dr. Mohammed Zubair Akram, MBBS, FCPS, Medical Education. Learn, explore, grow.
Hi everyone, my name is Dr. Zubair.
In this video, I'll give you a quick introduction to PET imaging.
First, I'll explain the differences between PET, CT, X-ray, and MRI.
Then, I'll show you how PET scans help detect cancer.
And finally, we'll talk about whether the radiation from a PET scan is dangerous or not.
Differences between PET, CT, X-ray, and MRI.
CT, X-ray, and MRI are part of radiology, while PET belongs to the field of nuclear medicine.
The biggest difference between these two groups is what they focus on.
CT, X-ray, and MRI show the structure of the body, organs, bones, and tissues. A PET scan shows how tissues are functioning at a molecular level.
That's why CT, X-ray, and MRI are called structural imaging, while PET is known as functional imaging.
If you hurt your ankle and there is a suspicion of a fracture, we'll order an X-ray or CT scan because both are excellent for bone injuries.
If a ligament injury is suspected, an MRI is preferred because it visualizes soft tissues very well.
But if a bone tumor is suspected, a PET scan is performed because it can detect abnormal cell activity.
How does a PET scan work?
A PET scan uses a radioactive drug called a tracer.
The most commonly used tracer is 18F-FDG, which is basically a glucose molecule with a tiny radioactive component attached.
About half of the radioactivity decays within 2 hours, so timing is important after the tracer is injected.
Because FDG behaves like glucose, the body sends it to cells that use a lot of energy.
And cancer cells are among the most energy-hungry cells in the body. As the radioactive FDG breaks down, it releases positrons, which are recorded by the PET camera and turned into images. As the radioactive FDG breaks down, it releases positrons, which are recorded by the PET camera and turned into images.
Cancer cells show up as bright spots on a PET scan because they take up much more glucose than normal cells.
A PET scan can show where the cancer is, how big it is,
and whether it has spread to other parts of the body.
One of the biggest advantages of PET imaging is that it can detect changes in a tumor's activity before structural changes appear.
Tumors change their glucose use before they change in size, so PET can detect cancer earlier than CT or X-ray.
Is a PET scan safe?
While no amount of ionizing radiation is completely risk-free, the radiation from a PET scan is actually quite low.
One PET scan exposes you to roughly the same amount of radiation as 2-3 years of natural background radiation, or what an airline pilot would receive during about 25 long-distance flights.
Overall, a PET scan is considered safe, and the medical benefits, especially for diagnosing and monitoring cancer, far outweigh the small radiation risk.